everybody. They came back.
I don't know
They
why.
came back for episode 2. ADHD.
Mm-hmm.
They're probably wondering if I have it, like the way I'm acting. But anyway, welcome back. Thank you for clicking episode 2 of K Speaks, me and Miss Rebecca's podcast, where we are talking about things that just really are not talked about that probably really needs to be talked about, right? So today's topic, ADHD.
Yes.
What does that stand for?
It stands for Attention Deficit Hyperactivity Disorder, but so many things. It needs to be renamed, and actually professionals like higher than above our pay grade are pushing for it to be renamed in the DSM, but that's later on in here. But I have an activity that I want to do with you. Is that okay?
Game on.
So this is a brain. This is the ADHD brain. We'll pretend.
Okay.
And in here, I put 4 chores that we both hate doing. So 2 for you and 2 for me.
Okay.
So there's 4 chores in here that we hate doing.
Mm-hmm.
And then there's pieces of paper that have an X on them. The X means hyperfocus.
Okay.
Okay. A blue X. And then there's paper in there that have nothing on it. And that just means like decision paralysis. It just means you're going to sit there and do nothing. Even though your brain's like, let's do the thing. We need to do the thing. And you're like, I can't. I just can't. So
I'm having problems with these directions. Like, I'm afraid I'm not going to remember.
it's okay.
You might have to walk me through them.
So pick out like 2 pieces of paper in my brain.
2?
Yeah. If you pick out a chore, I'm going to cry.
Do I give them to you after I pick them, or can I look at them?
You can look at them.
Okay. Blank.
Okay. Pick out another one.
Blank.
Decision paralysis. That means we're going to sit all day for 8 to 12 hours and have our brain scream at us to do something. And the other half of our brain is going to be like, nah, not today, man. Even though we've had our meds and we have things we have to do.
Mm-hmm. Oh.
But we're just going to sit there and do our thing. Not do the thing. So anyway, so I couldn't get my printer to work, so I'm going to be reading off my phone.
Okay, so I just sit here and just kind of...
If you want, or you can ask questions. I don't care.
Nothing?
You can fidget. I've been fidgeting.
Okay.
Because I have ADHD.
Okay. Here's my notes.
Okay. So, roundabout, like, TLDR, ADHD is a persistent pattern of inattention and or hyperactivity, impulsivity that interferes with functioning and development in like 3, what's that word? Spheres of your life, like school, work, and home.
Categories? Or spheres?
Sure, categories, sphere, whatever.
Okay.
But so you can be ADHD inattentive, ADHD hyperactive, or ADHD combined. Okay. I am ADHD inattentive. So that means roughly like if it's super boring, I'm not going to pay attention to it as much as I want to. I can't.
And do you tend to, like, is it pretty immediate? Like if the thing is boring and you're just like, oh, I'm done.
Yeah.
Or
it's instant.
Yeah.
Yeah.
Instant.
And like, how many times did I ask you, what am I doing for the podcast today?
Because I was boring.
No, you weren't boring, but I just couldn't keep it in my head.
Oh. Okay.
You weren't boring. It's just my brain was like, eh. I asked you like 3 times. Mm-hmm. Yeah. It was dumb.
Okay.
So TLDR for inattentive, like often fails to give close attention to details, makes careless mistakes, difficulty sustaining attention in tasks, like difficulty remaining focused during lectures, conversations, or lengthy reading. Grad school was so hard.
Elementary, junior high, like
Yeah.
high school, like
Just
that's
hard.
just hard for anybody.
Right.
Yeah.
Doesn't appear to listen when spoken to directly. That happens a lot.
Yeah. I know a lot of people like probably lose patience.
Yeah, we don't do it on purpose.
Right.
We can't help, like, we just can't help it. And so I try really, really hard. But I know with you that I can be like, I'm so sorry, what? Mm-hmm. And you're like, okay. Doesn't follow through on instructions or fails to finish housework, schoolwork, and duties in the workplace. Starts tasks but quickly loses focus and is easily sidetracked. I call those side quests. I have a whole closet full of like half-started arts and crafts projects. We won't discuss it. Organizing tasks. I can organize it, but when I walk into a room and it's a hot mess express, I will shut down, sit down, and be like, until somebody points me in a direction, I'm not going to know where to start. Disorganized. Sometimes I'm disorganized. Often avoids, dislikes, is reluctant to engage in tasks that require sustained mental effort, like completing forms, like for Medicare.
We talked about that last one.
It was awful. It's awful. Losing things, easily distracted, you name it. Forgetful in daily activities, kind of like I kept asking you, what am I doing? And then we have the flip side, hyperactivity. You just can't sit still, fidgeting, tapping, vocal stemming, can't stay in your seat. When children, they often run about in situations where it's not cool. Like you shouldn't get up in the middle of when your teacher's talking and just run around the classroom.
And I know that a lot of like providers and stuff, sometimes like when we're working with kids, like I just call it body wiggles. Like your body, you just have the urge. Like your body just feels like it has to wiggle. Yeah. Like you just are not meaning to, but it just is. It's just like, oh, yeah. So when I'm working with kids, I usually ask like, oh, it kind of looks like you have the body wiggles or something like that.
Yeah. My son has ADHD hyperactive, for the love of God and all things holy. He's an adult now, so he describes his hyperactivity when he has to move like he has an itch in his brain that he just can't scratch until he's moving. He's like, I just can't stand it. And that sounds awful.
Yeah.
Talking excessively. All my report cards said talks too much, and I would get detentions for talking too much. Are we shocked? Now I'm a therapist.
But you have to shut up and listen if you're a therapist.
Yes, I can. Blurts out an answer. Yep. Difficulty waiting for their turn. Interrupts. And then like the DSM. I have beef with the DSM, but that's for another day. A lot of practitioners won't even test for ADHD because of the simple fact the person may not be presenting with hyperactivity as a key symptom. So on top of the powers that be, they're also trying to take away hyperactivity as the main key factor with the next DSM that comes out with whenever that will be. I don't know. So there's lots of issues along with ADHD, and ADHD mirrors a lot of other diagnoses. So ADHD is often BFFs with depression, anxiety. Like they're holding hands, skipping down the beach, having the best time ever.
Also, I think with trauma.
Yes.
One thing, especially in kids, so I work with a lot of trauma. And I don't think people realize, and so I think it's being more talked about now, that if someone is unfortunately experiencing something like physical emotional, sexual abuse, they're going to struggle to have focus in school. So, little kiddo, if they're worried about needing, when the bell rings at the end of the day and they're going to have to go home and they know what may be waiting for them at home. So yeah, they're going to be anxious. They're going to be fidgety. They're going to struggle to sit in their seat. And that's going to mirror other things like ADHD.
Yeah.
So that is really the unfortunate part. And so that I think is coming more to light. But I think.
And the window of tolerance.
Yes. And I think too that I think ADHD can sometimes be the go-to, and there's not more digging into what may be currently going on, social history, family history, to maybe look at that kind of stuff that may be potentially going on with some possible trauma.
Right. And unfortunately, so like I was late in life diagnosed ADHD, but like looking back at like my report cards and like struggling in college and in grad school, I was like, why in the hell didn't anybody like pull my parents aside and say, you need to get her checked? Well, that was in the 80s, and it's considered a boy disorder, and a lot of females present inattentive. So we're daydreamers. We are like have our nose in a book. We're not paying any attention. We're not hyperactive. Naughty. I don't know. I don't want to use the word naughty. Making poor choices.
Yes. I have a beef with the word naughty.
Yeah. So making poor choices. So anyway, where was I?
Kind of like, I guess stemming from that, that is something that I guess really hurts my heart, is that a lot of people get reprimanded because of their symptoms.
Losing their jobs.
Yeah, losing their jobs, especially kids.
Getting held back in school.
Yeah, just like losing recess or something.
Remember last year I fought for that. Yeah. I got into a fight with the school for a kid to have recess.
Yeah, exactly. So it's very, very unfortunate that some places even today just are not using the appropriate approaches and techniques with folks that maybe have a diagnosis of an ADHD. And instead of kind of, like cookie cutter, get in the cookie cutter.
Get in this box.
What may work for one person with ADHD is going to be different from another person with ADHD. And there might be some similarities, but that's what you have to find out. So I think that's still going on.
Yes, it is.
Yeah.
Actually, so like ADHD came to like professionals, I don't know, attention in 1798. There was a chapter in a medical book called Diseases of Attention. And then in 1902, George Frederick called ADHD a moral deficit disorder. You're going to love this. Just wait. And then in 1930s, ADHD was called minimal brain damage. And then in the later 30s, it was called minimal brain dysfunction. And then in 1968, with the DSM-2, it was called hyperkinetic reaction of childhood. And then they kind of got it together by calling it, in the 1980 with the DSM-3, they got it together and was like attention deficit disorder. And then it was introduced into 2 subtypes. But
I love how you're like, they got it together. They got it together.
Okay, but
I don't think they really did.
They didn't, because ADHD is not, because we can pay attention.
Yeah.
Okay, so sorry, I'm like geeking out, getting excited. I'm like stuttering. It does not mean that we have the inability to pay attention. It just means that we fail to pay attention to what's important at the time, to no fault of our own. So they're also pushing to have ADHD renamed to executive functioning deficit disorder, which I 1,000% agree with. So that's where ADHD lives. It affects your executive functioning. And I highly suggest everybody to go look up Dr. Russell Barkley on YouTube and anywhere else you can find him. He is like the guru of ADHD. He is phenomenal. I love his work. A lot of people get a little pearl clutchy because he's just like, these are the facts. And he just rips the Band-Aid off. But I appreciate it. Like, rip it off. So Dr. Barkley states that the core of ADHD is the inability to self-regulate, meaning individuals with ADHD are unable to delay responses which make them act impulsively and without consideration of future consequences, both positive and negative. What do you think?
Yeah.
Yeah.
It's kind of that instant cry or mad.
Right.
And not really having the ability to say, well, you swung at so-and-so, and just trying to rationalize that out with a person. They just are not able to at that time.
Right.
So they just know, well, this happened. I'm pissed off. I reacted.
Right.
So I think a lot of people struggle with that too. Like that are not in that moment that are diagnosed with ADHD.
Well, paying attention is a lot of work that is a nanoseconds of things to pay attention. Like we have to focus on the task in front of us, but also be able to like regulate our voices and our emotions and everything else. It's a lot of work.
Yeah. I know it's exhausting for a lot of people.
Yeah.
So what do we see the most from that clients are experiencing that maybe have already been diagnosed with ADHD, that we have them coming to us, do you think?
Like their diagnoses?
That they're just their experiences with ADHD.
Oh, being told that they just need to work harder. Is that what you're getting at?
Yeah.
Okay.
Yeah.
But you need to work harder, pay more attention, figure things out, ask for help.
I think it's been unfortunate, but one of the most common things that has come up in sessions lately with folks that either have processing struggles or
Which lives under ADHD.
or have the diagnosis of ADHD, and people have been pressuring them, other outside people, of, well, you just need to get more organized.
Oh my God. If only.
And so then it makes the person feel horrible.
Yeah.
And then they may come to session and say, why can't I be normal? Why can't I do this? Why can't I do this? I want to be normal. What's wrong with me?
Right. And then the core beliefs.
That is the most significant thing that has come up. Why can't I be normal? And what is wrong with me?
Right.
And so that has come up so much in just the last few months. And my response a lot of times is that there is no normal.
I'm normal.
Well, then you just stand out above the rest, I guess. I don't. So, again, with this podcast, you can take it or leave it. You do not have to agree with what I'm saying. But I think a long time ago, we got stuck on this normal stuff. But think about it. Each person has completely different DNA. Yeah, we have some similar things. We have similar organs, but they look different. They might have the different shades of colors. Our blood is different. It might be this type, this type, this type, this type, this type, this type. But our brain composition is different. Our personalities are completely different. You're unique. You are unique as a person. And so how can you compare one unique person to the next unique person? Because you can have two people experience the exact same thing, and they will see it completely different. They will feel it completely different, and they will have different insight and react different. And I mean, you can just go down the line. So I just don't see how you can say between those two people that you can't say there's a normal. There's no way to measure that. And so I think sometime, whenever, scientists or whatever you want to call it, they usually try and strive for a homeostasis. Like if they're scientists or something like that. I don't know. But a homeostasis is kind of like your comfy level. Like where do you feel comfy? Where do you feel like your daily function is pretty good? And that's different for everybody. And so they take kind of like, well, physically, a toe kind of looks like that, And so how can we tell? I know I'm like bouncing all over, speaking of ADHD. But how can we tell a normal toe from like an infected toe? Right? Yeah. Or like a toe that and of course I'm saying normal, but how can we tell if everybody's big toe is either not infected or infected? Because everybody's big toe looks different because everybody's unique. And so I think that's when things started developing between normal and not normal. But everybody's so different. I don't think you can sit here and say, take these two people and then say, oh, well, this is this is normal. Well, they're acting that way and that's not normal. And you act this way and that's not normal. What is the comfy level for that person? And what's not the comfy level for that person? When are they struggling?
Sounds like that needs to be a whole episode.
Maybe. Okay. But I think someplace, somewhere, sometime, it's the language switched to normal. And so when that comes up in sessions that I have, I just tell people, you were put together, you were made a certain way. Your brain was made a certain way, and that is okay. I know they probably get told all the time they're crazies or whatever, but it's okay. They were made a certain way, and they are unique compared to anybody else. So,
okay.
I know you don't like my long spiels or whatever, but
it was a tangent.
It was a tangent. And maybe that's what these will turn into. I don't know.
Oh my God. So back to ADHD. Katie can have her.
Speaking of.
Maybe
I should be tested. I don't know.
So the executive functioning that ADHD really affects the most are nonverbal working memory. So it's being able to get directions from somebody and having it and remembering it instead of losing it 2 seconds later and then calling your boss again asking, what are we doing for the podcast? It's remembering a phone number, remembering why we walked into a room, why we opened a Google tab. We have to hold the who, what, when, where, why, the goal, the steps, and the how. Although I think I said how.
So does like writing it down or
Yes.
typing it, and maybe
Typing it is no good for people. Well, I can't generalize for everybody for ADHD, but it is recommended by people with a higher pay grade than me, like with the PhDs.
just because they might have higher doesn't mean they might be right.
Well, okay, but they highly recommend, for this is me skipping around, to externalize as much as we can. So writing it down, typing it, I'm not going to remember it. But if I write it down, I'm be like, oh yeah, I remember writing it down because like my dog jumped up in the air and caught a fly, and I remember writing it down. And yeah, so
No, that
externalize.
makes sense.
Yeah. Another piece of executive functioning that ADHD affects is verbal working memory. So verbal commands in our inner voice. So you tell one of your kids to grab their socks and shoes, they see something shiny and they go on a side quest, and you're like, bro, where's your socks and shoes? And they are playing with Legos in a corner, and you're like,
Yeah.
you're like, hello, like, come on.
That's probably every parent out there right now.
Well, yeah. It's also remembering a recipe that you've made a lot without having to look it up every time.
Going in a room and not remembering why you went into the room to grab something that you need.
That's nonverbal working memory.
Oh, man.
Self-regulation. This is the biggest piece that they're trying to put back into the DSM. They're trying to not make hyperactivity as a key feature, but more self-regulation. So people with ADHD can be quick to anger, easily excitable, have a low frustration window, have the inability to self-soothe, and failure to regulate quote unquote normal emotions. Happy, sad, anger, you know. And I just want to point out that you cannot be impulsive in your behavior and not be impulsive in your emotions. They go together. You cannot do one and not the other. So like a person is getting mad because the drive-thru is taking forever and yelling and honking their horn. Mad is the impulsive emotion, and yelling and honking their horn is the impulsive behavior. Unfortunately, this is super sad. 50 to 70% of second graders are rejected by friendships. Sorry. 50 to 70% of kids are rejected by their friendships by second grade because they cannot manage their emotions. Let's see. Another executive functioning is planning. It's the failure of persistence towards a future goal, which is what I was talking to you about a couple nights ago with that one client. By the time we feel it, it's too late. We can see the boat coming, and we're like, yeah, we got time to get off this island. Everybody around us is done, evacuated, but the ADHDers are like still making their sandcastles, and we will not leave that island until the boat is in our face. And then we're like, shit.
So do you think like specific deadlines are helpful?
No, because I didn't, for some, yes. Personally, me, it gives me an idea and then it's like running in my brain. But grad school, I got through mostly with extensions because I could not get my poop in a group. I was just, I tried everything.
So for deadlines, like, you know, if you need to get like paperwork done or if you need to do a certain thing, like what would be your suggestion to help?
Suggestions would be, so like say if next month you want me to do this really hard podcast thing that I'm like, that's out of my wheelhouse. What would be easy for me would be, okay, so in a week, you and I are going to get together. We're going to have an hour meeting, and I want you to show me what you have. And then don't micromanage, but just check in. So like have regular meetings of like, show me what you have. Let's work on it. Just being supportive in that way.
Okay.
And I know that's a lot of work for the non-ADHD person. So, I mean, that's what's suggested is regular check-ins, but not to be micromanaging, which is a fine line.
Well, what if someone doesn't have like a really good support? What if they're just kind of doing it by themselves? What would you suggest?
What is to write down all on a piece of paper and put those pieces of paper everywhere, and then maybe have friends check in and say like, yo, how's that going? Or wait, did you say no supports?
Yeah.
Oh.
So like if they don't have like a really great support system, and so like they really need to do things kind of by themselves and fill out like paperwork and stuff like that, and they're like, oh my God, I'm, like for insurance or something, like for Medicaid, there's the Medicaid reviews, or they're in school and they're not getting stuff turned in on time, so, and they just don't have support. What may you suggest might help that person?
Externalizing it as much as possible. So writing it down, write down the due date, or do it right then and there as soon as you open the envelope and you're like, oh, I got to do this. I'm going to sit down right now and do this. Put all the reminders in your phone, like utilize your phone as much as you can, and set multiple reminders. You're going to annoy yourself, but you can. And don't snooze the reminder or turn it off. You can snooze it, but don't say done until it's done and let it keep screaming at you.
Yeah, piling up.
Yeah.
Okay.
So many things. I guess I just want to finish with like some myths of ADHD. A lot of people blame ADHD on poor parenting. Parenting does not have an effect on ADHD. It's a neurogenetic disorder. Some people think ADHD medications are addicting. For a neurotypical person, yes, they can be addicting. For a neurodivergent person, it makes our world bigger. Addictions make the world smaller. Some people believe that sitting next to the naughty kid at school is going to make somebody have ADHD. It doesn't.
Oh, like rubbing off on other people? Oh,
yes. Social factors are affected by it, but like I can't give you ADHD.
Oh. I don't feel hyper at all.
No.
Or inattentive.
Yeah.
So it didn't rub off on me. Oh, okay.
Yeah. There's lots of things. Like I said, it mimics other disorders and all that. I don't know. I have so many other things to say, but
yeah. Well, yeah. And I think that's the point, is that there is a ton of things to be covered in this area, and which we could probably cover in another episode. But
of like tips and tricks.
Sure. I think sensory too.
Oh yeah, with my that I've been playing with for an hour.
Yeah. No. And just maybe different approaches too. From like a therapist or provider perspective,
and a person who has it.
Yeah, exactly. So
thanks for listening to me ramble.
You ranted too.
Just about the DSM.
Yeah. Hopefully it's changing. Hopefully it's changing.
Not fast enough.
Yeah. All right, everybody. Keep listening and tuning in and watching. We appreciate it so much. Hang in there as we're still getting adjusted to this whole podcast thing. We'll get better, promise. But please subscribe. Please pass it on. We still have lots and lots to talk about. Our list keeps getting longer as we keep thinking about things and people share things with us for us to talk about that really should be talked about. So subscribe, pass along the info. Please keep, watching. us kind of muffle through this, I guess.
Mm-hmm.
But we appreciate it and you tuning in. So we will look forward to seeing you for episode 3. All right. Till then, see you later, guys.
Bye.
Bye.